Peptic ulcer disease. The term peptic ulcer disease refers to both duodenal ulcer and gastric ulcer disease. They cannot be distinguished definitively without endoscopy. The name is a misnomer based on the mistaken belief that they were caused by the protein-digesting enzyme pepsin. Etiology: peptic ulcer disease is most commonly caused by Helicobacter pylori. NSAIDs are the second most common cause because of their effect in inhibiting the production of the protective mucus barrier in the stomach. NSAIDs inhibit prostaglandins, and prostaglandins produce the mucus. Less common causes of peptic ulcers are Burns head trauma, Crohn's disease, gastric cancer, gastrinoma, Zollinger-Ellison syndrome. Note: alcohol and tobacco do not cause ulcers. They delay the healing of ulcers. Presentation: peptic ulcer disease presents with recurrent episodes of epigastric pain that is described as dull, sore, and gnawing. Although the most common cause of upper GI bleeding is peptic ulcer disease, the majority of those with ulcers do not bleed. Tenderness and vomiting are unusual. Duodenal ulcer disease is more often improved with eating, whereas gastric ulcer disease is more often worsened by eating. Hence, gastric is associated with weight loss. You cannot definitively distinguish duodenal ulcer, gastric ulcer, gastritis, and non-ulcer dyspepsia without endoscopy. Diagnostic tests. Upper endoscopy is the most accurate test. Radiologic testing such as an upper GI series can detect ulcers, but cannot detect the presence of either cancer or H. pylori. In those who are to undergo endoscopy, there is no point in doing non-invasive testing such as serology, breath testing, or stool antigen detection methods. Endoscopy is the only method of detecting gastric cancer. Cancer is present in 4% of those with gastric ulcer but in none of those with duodenal ulcer. Treatment: peptic ulcer disease responds to PPIs in over 95% of cases, but will recur unless H. pylori is eradicated in those who are infected. H. pylori is readily eradicated with PPIs in combination with 2 antibiotics. The best initial therapy is a PPI combined with clarithromycin and amoxicillin. In those who do not respond to therapy, metronidazole and tetracycline can be used as alternate antibiotics. Adding bismuth to a change of antibiotics may aid in resolution of treatment-resistant ulcers. Retest with stool antigen or breath test to confirm cure of Helicobacter. The only use of tetracycline is Helicobacter treatment. Treatment of refractory ulcers. If the initial therapy does not resolve the duodenal ulcer, then detecting persistent H. pylori and switching the antibiotics to metronidazole and tetracycline is appropriate. For those with gastric ulcer, a repeat endoscopy is done to exclude cancer as a reason for not getting better. Ultimately, the most important reason to scope a patient is to exclude gastric ulcer as a cause of the pain because of the possibility of cancer. The only way to exclude cancer is with biopsy. You can test for H. pylori with non-invasive methods and treat it, but you cannot exclude gastric cancer non-invasively. Hey amazing viewers! Just a humble request to support my channel. Please like and share my videos and don't forget to subscribe my channel.